All right, so we've now adjusted the wax rim and continue biting down. I reduced the flanges here, which reduced how much of the upper lip was interacting. What do I mean by that? The length of the wax rim has everything to do with how much is in the vestibule. So the facial thickness of the wax rim in the vestibule will actually increase the display of the wax rim. So you always want to make sure that you're keeping that in mind, because if you adjust it after you adjust the wax rim, then you've actually lost display of the wax rim. So here I reduced those undulations that were in the canine area of the wax rim before I really started to get a sense of where the incisal edge is. So I'm having her lightly bite down. Go ahead and relax now. That's about where I'm thinking her aesthetics need to be. About 1 millimeter of display is a pretty good approximation of where things need to be. Now the other thing I'm looking at is lip patency or lip competency. I like that. I don't think it's too much, but I think it is giving her some fullness in this area. You want to make sure that you're communicating with the lab how thick you need that tray to be to get the lip support that you want. Yes, you can add wax to it to build that support, but you have to make sure you tell the lab exactly follow that dimension. We always fall in the trap of just sending it to the lab thinking that they're mind readers. They don't have that much information. We have to communicate these things to them. So here, if we look from the side, she almost looks a little bit class 3, looking from this angle. So I like where the wax rim is in her face, the edge of it, but I think she needs a little more thickness in the vestibule. Now what I'm going to do is reline this, and as part of relining it, I'm going to add some PVS thickness to that area, and then I'll trim that back until I'm happy with the lip thickness, and then I'll tell the lab to match that facial dimension of the denture flange thickness in that area. So we will see you back.